A virus so small, yet so dangerous, capable of scarring the liver, destroying cells, and causing cancer. This is hepatitis B, one of the deadliest viral infections known to man. Hepatitis B is caused by the hepatitis B virus, HBV, a partially double-stranded DNA virus from the family Hepatidinavirinae. It specifically targets hepatocytes, the functional cells of the liver. Worldwide, more than 250 million people live with chronic infection, making it a global health crisis. HBV is transmitted through blood and body fluids, from mother to child at birth, vertical transmission, through unsafe blood transfusions or unsterile injections, via unprotected sexual contact, or by sharing needles and sharp objects. But it does not spread through hugging, kissing, or sharing meals. Here's the paradox: the hepatitis B virus is not directly cytopathic. It doesn't kill liver cells itself. Instead, the host immune system, particularly CD8 cytotoxic T lymphocytes, attacks infected hepatocytes. This immune-mediated injury causes hepatocellular necrosis, inflammation, and, over time, fibrosis. In other words, the body's own defense system creates the liver damage. In adults, over 90% clear the infection spontaneously. That's acute hepatitis resolving naturally. But if infection occurs in infants, more than 90% progress to chronic hepatitis B, where the virus silently persists in the body for years. Chronic infection can lead to cirrhosis, hepatic decompensation, and even hepatocellular carcinoma, HCC. Symptoms vary. In acute hepatitis B, malaise, anorexia, nausea, right upper quadrant pain, jaundice, dark urine, and elevated serum ALT over AST. In chronic hepatitis B, often silent, until complications like portal hypertension, ascites, esophageal varices, or hepatic encephalopathy appear. Diagnosis is through serology and molecular tests. 1. HBsAg is the infection marker for acute or chronic. 2. Anti-HBs shows immunity from vaccine or recovery. 3. HBeAg shows high viral replication and infectivity. 4. Anti-HBc immunoglobulin M shows acute infection. 5. Anti-HBc immunoglobulin G shows past or chronic infection. 6. HBV DNA via PCR quantifies viral load. Now the big question: is hepatitis B curable? The answer is no. For chronic infection, currently, there is no complete cure. This is because HBV integrates into the host genome and forms covalently closed circular DNA, cccDNA, inside hepatocytes, making total eradication extremely difficult. cccDNA is a stable form of the HBV genome that remains inside the nucleus of liver cells. After the hepatitis B virus infects a cell, its DNA is transported to the nucleus, where it is converted into this special cccDNA form. cccDNA acts as a template. It keeps producing new viral particles even if the virus in the blood is suppressed. It is highly stable. It can persist for the entire lifetime of the hepatocyte. Current antiviral drugs, like tenofovir and entecavir, can suppress viral replication in the blood, but they cannot completely eliminate cccDNA. This is why chronic hepatitis B is not curable with present therapies. Think of cccDNA as a hidden archive or backup file inside the liver cell. Even if you delete all the virus copies in the blood, the hidden archive can reactivate and produce new viruses. However, it is controllable. For acute hepatitis B, with supportive care, most adults recover. In most healthy adults, over 90 to 95% of acute infections clear spontaneously. The body's immune system successfully eliminates the virus and HBsAg disappears. Anti-HBs antibodies appear and patient is considered cured and immune for life. So yes, acute hepatitis B is curable in the sense that the virus is completely cleared from the body. Exceptions are, in infants and young children, the immune system is immature and they often fail to clear the virus, and about 90% progress to chronic infection. In immunocompromised adults, clearance may also fail. In chronic hepatitis B, long-term antiviral therapy with tenofovir or entecavir suppresses replication and reduces complications. Pegylated interferon alpha may be used in selected cases to boost immune clearance. In end-stage liver disease, liver transplantation may be life-saving. The timeline from acute HBV infection to chronic infection depends mainly on age and immune response. The acute phase usually lasts up to 6 months. If HBsAg, surface antigen, persists beyond 6 months, the infection is defined as chronic hepatitis B. In newborns or infants, 90% will progress to chronic infection. In children under 5 years, 30 to 50% develop chronic infection. In adults, less than 5 to 10% progress to chronic infection. Most clear the virus. The best cure is prevention. And we have it, the hepatitis B vaccine, safe, effective, and provides lifelong immunity in most people. The birth dose within 24 hours, followed by the full series, prevents neonatal transmission. Safe blood practices, screening, and public awareness are equally critical. Vaccination remains our strongest weapon. Hepatitis B may not yet have a cure, but it can be prevented, managed, and controlled. Researchers are working on new therapies targeting cccDNA directly, which could finally make hepatitis B curable in the future. As doctors, students, and members of the public, we must raise awareness, encourage testing, promote vaccination, and ensure treatment, because protecting the liver is protecting life itself. Don't be an asymptomatic carrier of knowledge. Spread it. Like, share, and subscribe.